Dapagliflozin and cardiovascular outcomes in type 2 diabetes list of authors. Background: the cardiovascular safety profile of dapagliflozin, a selective inhibitor of sodium glucose transport 2 that promotes glucosuria in patients with type 2 diabetes, and is undefined.
So the heart failure community is delighted to see the results of DAPA-HF. There was a signal that the SGLT2 inhibitors had an impact on the incidence of heart failure and the development of heart failure, but DAPA-HF said in patients with established heart failure, I can't say the whole long word, DAPA actually reduced hospitalizations for heart failure, and overall outcomes are beneficial. This is in patients with and without diabetes and heart failure with reduced ejection fraction. This is great news. This means we have yet another drug. The clinical implications is that the heart failure clinician needs to figure out where to add that and when. The DAPA study population were well-treated patients. They may not have all been on ARNIs, but they were on good regimens of beta blockers, ACE or ARBs, and some on MRA. So this was a well-treated population. Does that mean we have to wait till people are on standard medical therapy? This is what we're going to have to figure out, and there'll be lots of discussion.
Methods. We randomly assigned patients with type 2 diabetes who had or were at the risk of atherosclerotic cardiovascular disease to receive either dapagliflozin or placebo. The primary safety outcome was a composite of major adverse cardiovascular event, defined as a cardiovascular death, myocardial infarction, or ischemic stroke. The primary efficacious outcomes were MACE, and the composite of cardiovascular death of hospitalization heart failure. Secondary efficacy outcomes were renal composite, estimated glomerular filtration rate of 60 mL per minute, new end-stage renal disease, or death from the renal cardiovascular causes.
With all the choices of anti-hyperglycemic medications for people with type 2 diabetes, it's important, of course, to be able to individualize therapy, and in particular to look at the patient profile and see whether or not certain medications are more effective, less effective, safe in these specific populations. In particular, we've been focusing on people over the age of 65. There are a number of reasons that we do that. First, people over 65 tend to have other medical conditions. They may be taking other medications. And importantly, a large proportion of them, close to 50%, have mild renal insufficiency or stage 2 chronic kidney disease. So we performed a study which was actually published and presented here at ADA last year, where we looked at sitagliptin compared to dapagliflozin, an SGLT2 inhibitor, in patients who had mild renal insufficiency. In that study, the primary analysis showed that sitagliptin was both non-inferior and superior to dapagliflozin, and had a safety and tolerability profile which was, both were very comparable. In this analysis, which we've presented here at ADA, we've specifically looked at the population in that study who were over 65 years of age. They comprised about 2/3 of the population, so it was a very robust study to look at this issue. And in this post hoc analysis, what we saw in the older population was a very similar efficacy profile to what was seen in the primary study. Sitagliptin and dapagliflozin, both were effective at lowering A1C. Numerically, sitagliptin provided a little bit more A1C lowering than dapagliflozin. The safety and tolerability profiles were comparable. There was a slightly higher rate of drug-related adverse experiences with dapagliflozin, but that was primarily driven by genital mycotic infections, which is common with the class. So what are the implications of the study? I mean, I think, clearly as the population is getting older and the prevalence of diabetes is higher, in people as they get older, it's important to have studies that specifically focus on the profile for patients. And so we think this post hoc analysis adds to the database regarding the choices of antihyperglycemics for older individuals.
Type 2 diabetes. Type 2 diabetes is a lifelong disease that keeps your body from using insulin the way they should. People with type 2 diabetes are said of insulin resistance. People who are middle age or older are most likely to get this kind of diabetes, so this used to be called adult onset diabetes. But type 2 of diabetes also affects kids and teens, mainly because of the childhood obesity. It is the most commonly type of diabetes. There are about 29 million people in the US with type 2 diabetes. Another 8.4 million have pre-diabetes, meaning their blood sugar or glucose is high but not high enough to diabetes yet.
Understanding type 2 diabetes. Type 2 diabetes is a condition where your blood sugar levels, otherwise known as glucose levels, are too high. This occurs when your body cannot use the glucose you get from food. In healthy people, the pancreas releases a hormone called insulin when we eat. Insulin switches on the cells around your body to absorb glucose and use it as fuel for energy. But for people with type 2 diabetes, the body does not respond to insulin. As a result, glucose builds up in the blood. This can damage the arteries, which supply blood, oxygen, and nutrients to your organs. Damaged artery walls make it easier for fatty deposits to build up. This can limit the circulation of blood and oxygen, and make it 2 to 3 times more likely for you to have a heart attack, stroke, or develop vascular dementia. The BHF is funding research into how diabetes increases your risk of heart and circulatory diseases, and discover new treatments to counteract the risks. Potential symptoms of diabetes include being more thirsty and more tired than usual, and having blurred vision. However, some people may not have any symptoms and don't know that they have diabetes. We still don't know why some people get type 2 diabetes and some don't. But we do know you're more likely to have diabetes if you are overweight, especially if you are carrying a lot of weight around the middle. Improving your diet and doing 20 to 30 minutes of exercise a day can help reduce the risk of developing complications related to type 2 diabetes. Cut down on sugar and saturated fat. Avoid large food portions and eat more fruit and vegetables. If you smoke, it's time to quit. Take control of your type 2 diabetes. For more information, visit bhf.org.uk/diabetes.
Signs and symptoms of type 2 diabetes: being very thirsty, paying a lot, blurry vision, being cranky, tingling or numbness in your hands or feet, fatigue, ones that don't heal, hunger, weight loss without trying, getting more infections.
What should our patients be looking for as symptoms of type 2 diabetes?
Diabetes symptoms can vary between patients. In very early stages of the disease, they may not notice any symptoms. This is why it's very important for all patients to see their primary care physicians at least once a year, to have a wellness check and get their routine labs once a year to see where their numbers are. And as the disease progresses, they may start to develop symptoms like feeling thirsty constantly, drinking lots of water, urinating profusely, and continuously feeling hungry even after they have eaten. If the disease remains uncontrolled for a long period of time, then they start to have symptoms related to diabetic complications. Diabetes can affect eyes, so even blurred vision, blindness, kidney disease, neuropathy, numbness, tingling in their feet. If they lose feeling in their feet, they can step on sharps and they can cause ulcers. So in very late complications, you can even see the bladder and bowel dysfunction. So I would say diabetes has a large spectrum of symptoms.